Okay, people are starting to come in here, and I am just about done with my requests. Technical assistance in the background. So, um, I am going to begin. Our presenter has a lot to share today, so I'm going to make my portion very quick. Just want to thank you all for being here. If you are new to these lunch and learns, these forward-thinking sessions, and you are unfamiliar with Forward Service Corporation, just a quick reminder that we are dedicated to meeting people where they are, the people that we all serve. If you refer someone to us, we listen, take the time to meet them where they are, listen to their needs, and find specific resources that can help them overcome what they need to get to high wage employment. Um, if you have been here before, you know me. If not, I'll do a quick introduction. My name is Landon Solano. I'm a communications specialist here at Forward Service Corporation. If you ever have any questions about these sessions, you can always reach out to me at my email address here. Or if you have any questions about the newsletters, receiving them, wanting to receive them, resources within them, you can always reach out to me at my email address. That slide with my email address, as well as the rest of today's presentation, will be provided to you both in a PDF of today's different presentations and a video of today's session. Those will be sent out to you on Friday of this week. We will also provide to you a list of our FSC offices across the state so that you can find local resources near you. Also, there's a QR code at the bottom of this page of all of our pages. If you scan that, that goes directly to our website, or you can always find more information at fsc-corp.org. Okay, today we're talking about mental health support for mothers. We have Sarah Bloomquist, who I'll introduce in a second, of the Mom's Mental Health Initiative. We're going to cover how that helps cover mothers with mental health, the importance of mental health support for mothers, and some things you can do with the people that you serve to help them, start to tackle some of these things if they happen to be encountering them. I have a quick question for you all. We have 26 people here. I think that will be fine to start this, but I'm going to launch a quick poll. How would you rank the importance of mental health support for the people that you serve? How many people do you think need or would desire to have some mental health support? This is a 1 to 5, 5 being the most important, 1 or 0 being the least important. Just give this a few seconds to trickle in and see how everyone feels about it. Good to see most people are actually answering it. Okay. Give it a few more seconds, but it's starting to seem like overwhelmingly people are saying important or very important, 4s and 5s. Okay. Awesome. I will share these results in this slide deck when we get going. I'm going to share them right now so you can see. Overwhelmingly, people are suggesting that this is an important topic, an important resource that people need to move forward with their employment journeys or personal journeys. I was going through the Mom's Mental Health Initiative website, and I found this statistic there, and I found to be very enlightening, which is the high risk period for experiencing PMH, which is postnatal mental health conditions, begin at conception and can last up to 18 months after postpartum. And I found that to be such a wide window of need. I mean, obviously it can go beyond that as well, but the specifics that we're talking today is very I don't know, very pertinent, very interesting to see that there's a specific need for mental health support for mothers during this time. And I want to introduce our speaker today, Sarah Bloomquist, who is the co-founder and executive director for Mom's Mental Health Initiative, to speak a little bit about this, the importance of it, and Sarah, I'm going to let you take over. Feel free to share your screen. Thank you so much for being here. I'm just going to be quiet and take notes and ask some questions. I hope that you can illuminate us all. Thank you. All right. I think you need to unmute, though. Let me know if you need.
All right.
Oh, there you go.
There I am.
Hi.
Sorry. Great. Thanks for the introduction. Let me just get myself a little situated here. Um, and okay. So I'm going to make sure that you can see how my screen looks. Is it all okay?
Yes, it's looking great.
Okay. So it looks really huge to me. Ah,
Okay.
did I just, how's that?
That looks
Okay.
great. Yep. Perfect.
So this is a PDF version of my slides, so it's a little different.
Yeah.
So yes, I'm Sarah Bloomquist. I'm the co-founder and executive director of Mom's Mental Health Initiative. We are a group of experienced community advocates that represent moms in perinatal mental health spaces, and I will get more into that as we go. Um, but basically, our mission is that we are a grassroots nonprofit and we're dedicated to helping moms navigate perinatal mental health disorders. And we do that by sharing information, connecting them to resources, and providing peer-driven support. And really, our wish is for that all who suffer from one of these conditions has access to evidence-based treatment and peer support. And I'll definitely get into how we do that and how we can be a resource for you. But our promise to moms is that with the right help, you will feel better. And the key word there is right help, because oftentimes we have providers who really do not understand the spectrum of these conditions and can cause more harm than good. And that is one reason why we started this, is because we were seeing that happen so often, including to myself and my co-founder when we went through postpartum depression and anxiety. I just want to make a little note on our name. When we started this in March of 2016, we were two eager moms in the helping profession who just really wanted to increase access to the right care. But we recognize that not everybody who experiences these conditions identifies as a mom. And so I just want you to know that I may use the term mom quite often, or birthing person, or parenting person, or parent, but all are welcome here. And we, are here to serve anybody. The statistic is pretty alarming. There, 1 in 5 moms will experience one of these conditions in their pregnancy or postpartum period. And it is higher for those who are in lower socioeconomic areas. It's higher for women of color. And again, this is a stat that is what we know based on self-reporting. It could very easily be higher. Um, it is the number one complication of childbirth. Just to keep that in your head, this is the number one complication. So just some important definitions here to help you know where I'm coming from. When I use the term perinatal, I mean the perinatal period, which means pregnancy up to roughly a year, 18 months, 2 years postpartum. More clinically, I think it's referred to more pregnancy up to 1 year postpartum. Left untreated, it can continue longer and actually lead to a lifetime of mental health struggles. Sometimes these health disorders are also known as perinatal mood and anxiety disorders. But that doesn't include the condition of substance use disorder, which is a very prevalent condition in the perinatal population. They're very vulnerable to substance use disorders. Obviously, you've probably heard the term postpartum depression, but it's doesn't cover the range of conditions that can happen. And then there's baby blues, and baby blues are not the same as postpartum depression or perinatal mental health disorder. Baby blues are really a different time, different experience. It's within usually the 2 to 3 weeks postpartum. There can be hormonal changes, crying, but it's not impacting the mom's ability to function. What we're looking at is functioning and frequency of symptoms. So you could have some of these symptoms, but they're not impacting your functioning, and some weepiness after you have the baby, a little bit of anxiety is normal. But when it starts to influence your daily life and hinder you from engaging in your daily life the way you want to, and if these frequency of these symptoms increase, then we're looking at something more like a perinatal mental health disorder. Um, so I want to just start out with Karen and a little bit of her story. She was a mom that we worked with, and she came to us and said, by the time I realized I was in full-blown PPA, or that's postpartum anxiety, I was struggling and couldn't wait. I wasn't sleeping and was crying throughout the day while trying to maintain my career, and I was suffering from panic attacks. I couldn't get through to my primary doctor, and her nurse told me on the phone I couldn't take any medications because I was breastfeeding. I tried my OB. They told me to get counseling and to see my general MD. I tried my MD again, and she was on vacation for a week. I was suffering. My work was failing. Things started falling apart at home. I tried finding a psychiatrist, and none of them were accepting new patients for 6 months. This is a very typical story for people that we are serving. They are going through these symptoms. They don't know what's going on. Sometimes they come on rapidly. Because usually by the time someone reaches out, they can't wait any longer. And then you get primary doctors or an OB who aren't taking any ownership over helping their patient. You get false information like you can't take medication when you're breastfeeding. That's not true. And then we are dealing with a backed up, oversaturated behavioral health system, and waiting 6 months to see a psychiatrist is pretty common, unfortunately. So some statistics in Wisconsin, 16% of new mothers experience depression in the 3 months before pregnancy, 14% during pregnancy, and 12% in the postpartum period. 27% of pregnant and postpartum women in Wisconsin are battling an anxiety disorder. And unfortunately, 75% of those who are diagnosed with one of these conditions remains untreated. That is a very, very high number. And when this is really considered a crisis, because if somebody is not getting their treatment, it could be impacting their ability to bond with their baby, which can cause a lifetime of challenges for that child. Their mental health could suffer long term. It could impact the cognitive and behavioral development of that child. So there's a lot that can happen, including I'll get to that, including the death for the mom. And I will get to that statistic in just a minute. But I wanted you to see those with higher PMAD rates. And sorry, it says PMAD. I haven't changed that to perinatal mental health. Things are changing all the time in this field. It's maternal mental health, it's perinatal. But those with higher rates of these conditions are usually insured by Medicaid at delivery, smoked in the last 3 months of pregnancy, use WIC perinatally, and identify as women of color. So compared to white women, Black women are twice as likely to experience perinatal mental health condition, but they're half as likely to receive treatment. And that is really because of poor access to care. We have in Wisconsin a very alarming disparity issue going on. Across the country, Black women are about 2 to 3 times more likely to die from a pregnancy-related condition. In Wisconsin, that number is 5 times as likely. So we have access to care issues, institutionalized racism, a lot of poverty, but it doesn't matter your level of education. Black women, whether they are poor or wealthy, have an education, are at high risk for a perinatal mental health condition, other pregnancy-related conditions, and even death. So the cost of untreated mental health conditions. So when I shared with you that 75% do not receive treatment, we took that number and we also know that it costs about $32,000, $32,000 to for lack of treatment for a mother-child dyad costs about $32,000. So we took that amount, we took the birth rate, factored in 1 in 5 women, we factored in 75% aren't getting treatment, and what we come up to is that it costs the state over $300 million. This is 14 billion plus dollars that is costing our country because we do not support perinatal mental health well in this country. Loss in revenue, workforce development issues, needing a lot of interventions with children, with the family. These are long-term costs. We also know that in Wisconsin, the majority of pregnancy-related deaths were due to mental health. So that means suicide and overdose were the leading causes of death amongst pregnancy-related deaths in Wisconsin. That means that those kind of deaths are preventable. When we're talking about mental health deaths, suicide and overdose, those are preventable. We have a very, very high maternal mortality rate in this country, and it's higher than any other comparable country. We have poor care and we don't do enough. And it's a systems issue and it's a societal issue. But I think you all know that, knowing the work that you do, you get the lack of resources and support. So touch points, what we kind of believe at MMHI is that all healthcare practitioners who are involved in caring for a woman, anybody who has a touch point with a perinatal person, should feel compelled to make sure that they're receiving optimal care and excellent clinical support and guidance. So one of the reasons why I do a lot of these type of talks is because all of us who have touch points with perinatal people, no matter what way, we need to be clued into their mental health. We need to make sure that people are not falling through the cracks. It's not up to us to solve the problem or treat them necessarily, but it's up to us to make sure that they are getting what they need so that they don't fall through the cracks. This image is just really excellent, I think, because oftentimes what you see on the outside is very different than what the mom's experiencing on the inside, like in her reflection. And these conditions are agonizing. They can be terrorizing to you. They're extremely isolating. People feel very alone, and it robs your ability to access that joy that you should have when you have a child. So I want to kind of get in a little bit about each condition, and I'll run through it probably a little bit quickly, but anytime you need more information, everything is on our website. It's a great tool to just learn more about these conditions. But these conditions, like perinatal mental health disorders, include pregnancy and postpartum depression, anxiety. We're also seeing obsessive compulsive disorder, PTSD, panic disorder. We're seeing bipolar disorders and substance use disorders. And then there's also psychosis. So just kind of from the patient perspective, and that's what we pride ourselves on, is really bringing out the patient voice. So people realize that these conditions look different on everybody, and it's not necessarily a textbook type thing. But so first one, postpartum depression. One of our participants said, I was in such a bad place that I just didn't respond. I appreciated she was reaching out. When you're feeling all the things, it's overwhelming. Even though she genuinely cared, I felt so hopeless I couldn't even take that in. And she was referring, I believe she was referring to me because I was providing some resource brokering for her and really trying to get her connected. And this condition, the depression, just takes so much of your ability to and your capacity to do life that everything is overwhelming. She couldn't even like respond because she just felt so hopeless, and it was so much. So imagine sitting there having to call your insurance company, find somebody who takes your insurance, calling that person, maybe getting a rude receptionist, then being put on a wait list. Like this is absolutely overwhelming. So depression, it can look, like those classic signs. Someone's crying, they're depressed, they have low motivation. But you might hear it more in regret of becoming a mom in the first place, thinking you made the wrong decision to have a baby. I mean, that's an awful feeling. Like you had a baby and now you're like, I'm stuck. I made the wrong decision. I can't be a good mom to this child. There might be anger or rage that comes out, very common symptom. Sometimes really disconnected. I know when I went through it, I had a really hard time feeling connected to my child. I knew I loved him, but I just didn't feel that connection. Maybe numb to what's happening around you. Oftentimes people feel like they're in a fog, or they're watching from up above and watching everything go on. There's a lot of guilt and sadness. You feel like you're missing out on what you should be enjoying in those first days, weeks, and months. A lot of grief. There is a lot of grief that comes through these conditions. Once you recover, there's a lot that you've lost and experience and need to grieve. Sometimes you're just a mess. You can't stop crying. I've had moms like, I'll call the therapist once I stop crying. I'm like, it's okay to call them crying. Like that's what they're there for. They get it. And really, we hear a lot moms saying, I'm a terrible mother. My child would be better off without me. That doesn't mean they're going to go take their life. It's more of this passive feeling of, I'm ruining my child's life. I'm not a good parent for them. So you kind of hear those things coming out. I'm failing my child. Issues around breastfeeding, and they're having so much struggle. They feel like they're failing their child. There's so much shame associated with these conditions, and the condition itself evokes shame. So moving into anxiety, postpartum anxiety, or even in the pregnancy, can look like constant worry, this feeling of impending doom, like something bad's going to happen, racing thoughts that you just can't slow down, like you can't stop it, very fearful, fear-based, overwhelmed that your work is never good enough. Now, of course, you're a new parent, you're going to kind of feel like your to-do list is too long and you can't get to it. But this is where it's like impacting you so that you can't get to it. Like you're just so overwhelmed that you're paralyzed in that anxiety. You can have sleep or appetite disturbances. For me, I couldn't eat. I just couldn't eat. And then I had a lot of physical symptoms of anxiety, dizziness, nausea, diarrhea. Often for women of color, the symptoms come out in more physical manifestations, backaches, chest pains, soreness. There might be a sense of restlessness going on. They also might have a panic disorder and they're experiencing recurring panic attacks. And sometimes you'll just not have any clue this was going on. I had one person who ran 2 miles every day and was suffering from debilitating anxiety, causing her, she couldn't sleep, insomnia, um, very debilitating. One mom, Megan, said I was in the examination room with my OB, sobbing, telling him how much physical pain I was in, about the severe panic attacks, the dark thoughts, the inability to stop crying. All he said was that he didn't think it was postpartum depression, but to let him know if it got worse. I don't know what you could tell him, what else you could tell him to get him to see that this person is suffering. And she suffered. I mean, she had in very suicidal, took a long time to build a recovery. And so this is what I'm talking about when providers who don't understand these conditions do more harm than good. Like, she's in pain, she's going through so much, and he's like, well, that's not depression, but it's still a mental health condition that's happening. We're seeing a lot of postpartum OCD, so it's obsessive compulsive disorder. And this is like a form of an anxiety disorder, but it's this constant worry and nothing can bring you reassurance. And so you're constantly seeking reassurance. It might be like Googling all the time, Dr. Google, asking people, trying to seek reassurance, and you're spiraling in that. This is very characteristic of this condition is having a disturbed or dark, unwanted thoughts. We also call them intrusive thoughts about harm coming to you or your baby. And sometimes it's you committing that harm. Now, I want you to know that this is not the same as psychosis. This is something that is a typical condition. And actually, a lot of people who don't have OCD will have intrusive thoughts here and there, but you're like, oh, okay, that was a weird thought. Oh, that was strange. All right, well, that's not normal. I'm not gonna whatever do that. You go on. Someone with OCD is obsessing over these thoughts. There could be images of them throwing their baby down the stairs, images of them grabbing a knife and doing something to their baby, image of them driving themselves into a tree. They might then they go to great lengths to make sure things like that don't happen because they're so horrified by those thoughts. They're not going to act on them. It goes against their values. It goes against who they are. It goes against their system. But they might, you know, have the obsessive germ phobias, and then like excessive hand washing, cleaning the everything that the baby touches obsessively. Sometimes like it comes out around like their feeding, especially if they've been in the NICU and they've been so focused on making sure the baby's getting their nutrition so they can leave the NICU and they come home and they obsessively measuring formula, just or obsessively checking on their baby and not letting themselves sleep. And it's affecting their everyday life. Sometimes one person told me that she felt like it was like a freight train going through her head constantly of these thoughts. Another mom, she had these thoughts of her doing something harmful to her children, that she would never let herself be alone with them. And if she was, it had to be out, they had to be outside. So someone would see if she went, as she said, crazy. She wasn't going to do that. But she's so terrified of that. Unfortunately, people are afraid that if they share this with somebody, they're gonna like have the police called on them, which happens, or they're gonna call Child Protective Services, which has happened to participants we've worked with. And again, they're not gonna act on these. This is a real mental health condition that is highly treatable, usually medication and exposure type therapies. One mom, Emma, like she was working with a psychiatrist who was like, okay, this is what you're dealing with. Here's your meds. She had OCD. She was like not even leaving the room with her baby because she was so afraid. And then I think what happened is the psychiatrist went and talked to some of her other colleagues, and they're like, you need to call CPS, like to cover your butt. And then that just put her through this whole trauma because now CPS was being called. And we did damage control, and CPS ended up not coming out. They're just like, well, if you need any support, let us know. And then we connected her to a perinatal psychiatrist. And she was like, I can tell her about my intrusive thoughts, right? Like, she was so afraid to then be vulnerable to another provider. And she bravely was and got her treatment. Postpartum PTSD, this could be PTSD, from childhood, from certain things, but there's a lot of PTSD around birth trauma. Um, there's more trauma out there than we realize that happens in the birthing experience and even in the pregnancy period. Postpartum depression and all those conditions are trauma themselves to go through. But the NICU can provide PTSD. And again, it's subjective. So that trauma is defined by the person. The doctor might be like, well, you're fine. The baby's fine. What's the matter? And you're like, because my epidural wasn't working and you wouldn't believe me. And I delivered that baby without any pain killers, and none of you would believe me. I thought I was gonna die, and I kept telling you I think I'm gonna die, and finally they realized I was septic. This was another mom, and addressed it, but they weren't believing her. So there's a lot of a lack of informed consent, not believing women, particularly women of color. And it's not talked about. Like Luna said, the vast majority of people that I know did not go through it like I did as deep, and the few who did just don't talk about it. And the flashbacks, nightmares, avoiding things that remind you of that stimuli, anxiety, panic attacks, that sometimes can come a lot later after the event has happened, even months down the line. But it is very common, very common. Same as substance abuse is becoming more and more common. We're looking at a lot of opioid deaths. And in these statistics, it says that 15% of women who are less than a year from the birth of their child and have postpartum depression engaged in binge drinking. We are in Wisconsin. The cost of binge drinking to the state is astronomical. We have a drinking culture here, and it is. I think we have many alcoholics walking around who don't realize it. 9% also report abusing drugs, and then the prevalence rates are higher than women who did not give birth and who did give birth but did not have postpartum depression. So having postpartum depression, those conditions puts you at risk. If you have a history, you are at risk during that perinatal period. More women are psychiatrically hospitalized during their reproductive years than at any other time in their life. This is a growing issue in Wisconsin. And then psychosis. This is not as common, but it still happens. Some say up to 1 in 500. It is a psychiatric emergency. This is somebody has a break from reality. So as someone with OCD who has these weird thoughts and is horrified by them, someone with psychosis will have weird thoughts and it's normal and part of their reality. And they'll be like, oh, I need to go, and excuse me for being blatant, but they might say, like, I need to take my child's life because that's the only way the world's going to be saved. God told me to do that. There can be delusions, strange beliefs, hallucinations, lots of paranoia, suspicion. You'll see mood changes, like they can't focus, or they're like rapidly talking, and there's like a cognitive impairment going on. This is temporary and it's treatable, but it requires immediate attention. And people who have psychosis decompensate quickly. It is more common to happen within the first 2 weeks, and it is much more common for those who are bipolar disorder to experience it, untreated bipolar disorder. Those who are receiving treatment for bipolar disorder and get pregnant, please do not encourage them to get off their medication. They need to see a psychiatric provider who understands medication in the pregnancy period, because risk for it to reoccur, the bipolar, is 100% if they're off their medication. So it's just not a good thing. So this is a emergency. I can't get that enough, and that's where you might have to call the police and take someone to the ER, and they need to get that treatment. Lena, she was a mom in our Circle of Hope group. She said, when the ladies from MMHI told me I'm going to have to fight this battle for my life, I didn't realize how literal that was. And it really is just a devastating experience. It is on a spectrum, of course. There's can be not so severe symptoms to very severe, and the types of treatment could include therapy, peer support, connecting with others, and medication treatment. And that's something that someone has to work out with their provider, but it is not unusual for moderate to severe conditions to require medication treatment. So what do we do? How do we help people going through this? Well, one of the things we do is information sharing. So that's connecting and educating, empowering the communities to learn about perinatal mental health, just like what I'm doing right now. And we do a lot on social media. We do a lot of presenting. We do a lot of just getting into the community because we want people to be aware of these type of conditions. If you have your own work, like different places of work that you represent, if you want me to come in and do an overview, I can do that too. Resource brokering, this is one of the really amazing programs that we have, but we connect moms with these conditions to evidence-based treatment. So we have created a preferred provider list that we've vetted providers. So I'm talking about therapists, psychologists, psychiatrists, primary doctors, psych NPs, that we know and trust to be able to treat someone effectively and compassionately with one of these conditions, and that they understand the urgency to get somebody seen. So they know that if they can't get them seen, they're going to make a qualified referral or send them back to us. They're going to respond to an inquiry. They're not just going to leave them hanging. We also make sure they understand intrusive thoughts and the differences between OCD and psychosis. And so what we're able to do is people can go on our website, they can filter by their insurance company, by location, by virtual or non-virtual providers. And then they can also reach out to us and we can make warm handoffs to these providers. And we have like over 120 providers that we've referred to. We're always looking for more. Especially ones that take insurance. But we do have quite a few that take Medicaid. And then peer support, connecting moms with perinatal mental health disorders to one another. Peer support is crucial to the healing and treatment of a perinatal mood or anxiety disorder, because you feel so alone that if you do not have somebody there who gets it, who understands what you're going through and can tell you every day that you will get better, you will lose hope. This is where people find healing. This is where people keep themselves alive to their next appointment. This is where people find accountability and strength to stay on their treatment plan. We have an online Circle of Hope group for women in Wisconsin who are anywhere in their perinatal journey with one of these conditions. And they all share different points in the group. We monitor it. We have guidelines, we monitor it. But someone will post, I'm experiencing these intrusive thoughts and I'm starting my medication and I'm really afraid to start taking it. And you'll get all these other moms chiming in and be like, I felt that way too. And I'm so glad I started it. I know it's scary, but you can do this. They're not giving medical advice. They're not getting diagnosis, but they're just getting this much needed support. We're piloting this year of trying to support and empower other providers and groups to do more in-person type of support groups. People really crave that. Whether or not they can get to these groups is another issue. But even like as, when you're working with someone who's suffering and going through this, even just self-disclosing or saying, you know, I had a friend who went through this and this is what helped them get better, that that can give that person that permission they need to seek help. But when they can have a peer telling them, I've been there, I went through it, um, it makes a huge difference. Another organization to know about or a program is called the Periscope Project. And they are a perinatal psychiatric access program available to providers and professionals who are caring for perinatal women suffering from these disorders. So even if you're not, this is a program specifically for providers. So any of you who work with women and you're at, you know, you're like, I don't know what's going on. I'm not sure what type of support this person needs. You can call the Periscope Project and in real time, usually within 10 minutes, get conversation. You can get resources. You can talk to a perinatal psychiatrist. And just say, I'm not sure this person might be experiencing psychosis. I don't know what to do. You can get that. This is in Wisconsin for Wisconsin providers. It's not for the patient, it's for the providers. There's a lot of information. They have toolkits, they have screening policies, recommendations. We should always be screening every trimester and frequently in the postpartum period. And I can't stress what a wonderful program this is. We often do work with them. So what do moms need? So kind of wrapping it up, and then I want to answer any questions. These moms, they need to know how common it is. So these conditions are not normal, they're common. That's very important to clarify. They're not normal, they're common. They need to know they're not alone. Every day they need to know that they're not alone. They need to know they can choose what's best for them. So I believe in options for women during that perinatal period. If they don't want to breastfeed and they don't want to do it, that is okay. If they want to do it and they need that support, that is great. If they want to do pumping and breastfeeding, great. If they want their baby to stay in the nursery all night when they have their baby, fine. Like we need to empower moms to make their own decisions, obviously with quality information, but so often moms lose that power in that process, and we need them to know that they can choose what's best for them and their family. Not every baby is the same. Not all the babies don't read the baby books. So what works for mom and baby is right for them. They also need to know this is treatable, and they need providers to be compassionate and well-versed, know the latest research, medication. There are medication options for pregnancy and breastfeeding. Just know that. And they just need others to be committed to their mental health. And they need hope. So remember Karen, she said, desperate, I reached out in my local breastfeeding group and one girl referred me to MMHI. I was referred to a doctor and was seen the next day and was able to start on medication right away. Within a week, I felt better. Within 2 weeks, I felt great. I could not afford to wait for anyone once the postpartum anxiety hit, and no one else should have to. So just know that we are happy to help you if you want any more continuing education. If you have patients or clients that need referrals, that need support, please reach out. We do not have a phone number. We're not crisis managers, but they can reach out to us via our website, via our social media. We will take it from there. We're not intrusive. It's not like a clinic where we're getting all kinds of information. They have to give us their insurance card. This is about getting them treatment quickly and it not being an invasive process. We can provide that peer support. And then we also have our mom cards, which kind of give a little overview of these conditions and our information that you can hand out too. So any questions or comments, concerns?
Yeah, usually we have people put their questions in the chat. To get us started, I just wrote down something that while we're waiting for people to put anything in the chat, which is, well, first I just want to say I think you did a great job of demonstrating the intensity of feelings that people can feel. Um, and my question is for the people that don't experience that. I mean, we can't share our experience, in the moment with people, and have them feel it. For the people that aren't currently feeling that or have never felt that intensity in their lives, what would you recommend? What advice would you give to someone sitting across from someone who's explaining that
Yeah.
they are feeling that,
Yeah.
to help them, get on their way?
I think it's important to let them know about how common it is. Even if you haven't experienced it, say, this is rough. I know this is really tough for you. This is extremely common. This is treatable. I'm walking with you through this. I'm here for you. You are not alone. You don't have to self-disclose any, if you've never been through it, you don't have to self-disclose, but you can reassure them that they are not alone. So I think it's really important for people to normalize the situation,
Mhm.
to reduce that stigma and reduce that shame and guilt. And you do that by being present, even handing them a tissue when they're crying, saying, I hear you, I see you, and we're going to make sure you get help. That goes a long, long way. I mean,
Yeah.
and I hear that from moms, like they're like, I was just so grateful for my provider because they like pulled up a chair and looked at me.
Which I
That
was,
helped.
yeah, no, it did. It made me think a little bit of the slide you had, the quote, I think it was from Luna on your PTSD slide,
Mm,
um, about that people don't realize how deep they're feeling, and those that do don't want to talk about it. And
yeah.
I think there's a certain uncomfortableness. I don't know if it's, falls under Midwest nice or just generally, human empathy and compassion that they can feel overwhelmed by feeling, you use the word intrusive, maybe.
Mhm.
Uh, do you have any advice to help people get past that, to just help them
Yes.
be present?
I mean, part of the reason why I do this is I want to get people more familiar with these conditions so that
Mhm.
it's not so like scary when it
Mhm.
comes up. And that's why, like, even giving you those statements like, this is common, you are not alone, this is treatable. Those are really important words to use. And, um, I think you can't, this may sound silly, but I think a lot of us, including myself, have believed this. You can't give a person postpartum depression by asking them about it.
Mhm.
Like you can't tell somebody, you can't cause someone to go kill themselves by asking them if they're feeling suicidal. You can ask the questions. It's okay. Um, and you can just say, how are you adjusting to motherhood? Um, Tell me what this is like. What's it like when your baby sleeps? Is this what you expected? Um, Tell me more about that. They don't need to give you the details of their intrusive thought. You can
Mhm.
just say some people have these dark, scary thoughts that they don't like. It's really common, and I know they can be scary, but they're really common, and that's not you. That's not your heart. Um, so just asking those questions, and I mean, even using a screening tool, and people can email me more about those, like the EPDS. Talk through the answers. Don't just look at this form and put it aside. Like, let's go through the answers. Let's talk about it. Just tell me more. Tell me more about that. You can't cause the conditions by asking and talking about it. It sounds so silly, but I think we're all just afraid to bring it up. It's like,
Mhm.
you know,
Yeah, yeah. We just have a comment here in the chat. I just want to make sure I get to everybody. Let's read it. I appreciate you including real life examples and not paraphrasing really intense emotions. As someone who knows moms who are suffering from these conditions, this resource is so needed.
Yeah, so since March of 2016, like we've supported over 1,000 women. And we had from 2022 to 2023, 126% increase in inquiries and services provided. And we're like already 80% higher than last year. Like this is happening. This is out there. This is more common than we realize. And the more we talk about it, the more people are not suffering alone and they'll be able to bring it up. But I appreciate Amy you sharing that because we really want to represent the voices of those who are suffering and just the respect that they deserve in getting help and you just be shocked at how disrespected they are. And the more we need to do more for people in that perinatal period, because it is a highly, highly vulnerable time. And we just don't have the system set up for that. You get a 6-week checkup after you have, like, you see your doctor every week for like the month before you have your baby. You're seeing them through their pregnancy. And then you have this baby, you go through this major trauma of your body. Some people have a major surgery, during it. And then they're like, we'll see you in 6 weeks. How you doing? Like, okay. And then it's like, like, don't send me home. I don't want to go home. You don't
Yeah,
want to nurse with me. It's a lot. And we kind of just think it should be in other cultures, women they lay on the couch for 3 months while their family attends to them. Like they have grandma and mama coming in the house. Now, not all of us would want that, but there's just a lot more support. And so
yeah.
we're doing what we can.
Um, you just said something that jogged a question for me, which is, we're primarily dealing, the people on the line today are, partners and people that deal with, people that come in for services, resources. And I just know from, being exposed to a number of stories that there can be strife and alienation, as you said, amongst their families, them and, the people that they're connected to.
Yeah.
Um, if someone were to be sitting across from someone explaining that they feel disconnected or alienated from their family regarding these issues, do you have any advice on how they could start to talk to their family about that?
Yeah. I mean, it's really common to have family that doesn't get it. If they have a provider, I would really recommend them bringing um, the family member to the appointment to have a provider help explain it. Or if, I know a lot of people here work with WIC or, you bring in their family and you can kind of talk about it together. Um, this is where the peer support comes in handy because they're getting that support then from their
Mhm.
peers and not just having to rely on people who aren't getting it and who are, you know, cheapening their experiencing or minimizing it.
Yeah.
So I think it's important to provide the accurate information to their family members, and especially if they can have a provider who gets these conditions, bring a family member in with them. And it doesn't have to be the whole family. They don't owe their family any explanations. Um, and it's really hard to hold your boundaries with your family. Um, so just empowering them to be able to honor themselves and as the parent of their baby too. Like, this is my child, not yours. Like, I am not doing this. This is how it's going to be. No, you just can't drop by whenever you want. You need to call, set up a time.
Yeah.
Yeah.
Well, thank you so much for being here. I guess, is there anything left that you'd like to add?
No,
Yes, you
I
addressed
just,
that.
if you could take the survey, if, um, Real quick, we are, we are a nonprofit, so we rely on grants and donors. And what we need is data to present to these
Mhm.
entities. And it helps us when we have the data of we presented to this and their knowledge of perinatal mental health was improved this much. So I just really appreciate if you could, it's very quick. If you could go on and do that survey. And I just
Yeah.
thank you for your service. I know you all get it. You are in the helping profession, and I appreciate all that you're doing to support families and becoming their best selves.
Mm. Well, we're all in a position to improve and learn a little bit. So I think this is a very needed presentation to you know reiterate what Amy had said in the chat. So thank you. And I will just go through our little outro here as we wrap.
I can stop sharing. Is
Okay.
that enough time? Yeah, good.
Yeah, we're good. I think that's back up. We just went through question and answer. Um, just want to say thank you all for joining us today. You can follow us on social media. Again, as a reminder, we will be providing these slides in a PDF to you on Friday this week, as well as a video. So if you want the links, if you want that QR code to provide some feedback, that would be very helpful. And if you have any questions, you can always reach out to me. Really appreciate it. I want to thank once again Sarah Bloomquist for being here. Really appreciate your time, your expertise. It makes a world of difference. So thank you so much, and we hope that we'll all see you next month for our
Thank
next.
you.
Thank you, Sarah.